Welcome to another edition of Trail Runner Nation. My name is Don Freeman.
And I'm Scott War. What does it mean to be a trail runner in your 20s, 30s, 40s, 50s, or maybe even beyond? How do decades of movements shape our bodies, our minds, and our identities? Welcome to the second edition of the Aging Athlete Series. It's a mini-series on Trail Runner Nation, co-hosted by one of our favorite people, and ultra running legend, Krissy Mail. If you don't know who she is, she's an American ultra marathoner runner, renowned for her trail running achievements, including victories at UTMB, both in 2003, which I believe was the first year it ran, and then again in 2009, and becoming the youngest woman to complete the Grand Slam of ultra running back in 2005. Beyond racing, she's a coach. She's author of Running Your First Ultra, now in its second edition, and race director of the Chuckanut 50K. She inspires runners worldwide through her dedication to our sport. Now, this series, what we try to do is about every 5 to 6 weeks, we're going to explore what it means to grow older in the sport we love. How to train smart, how to fuel better, how to recover well, how to stay motivated, and carry decades of running with strength, wisdom, and grace. We'll talk to veteran athletes, sports scientists, experts, dietitians, everyday runners navigating this shared path, because all of us are getting older. I think Krissy mentioned before we hit record, Don says, we're all having birthdays, which means we're all aging athletes. And so it's not just for the old folks, guys. Today, well, first of all, we're also in this series, we're not here to have all the answers. We're here to ask the right questions and try to come up with ideas that will help us age boldly together. Today, we're going to talk to Dr. Scott Drum. He's an associate professor of exercise physiology at Northern Arizona University and a fellow of the American College of Sports Medicine. With a lifelong background in competitive running and research, sorry, you have to edit that, Ryan. With a lifelong background of competitive running, his research explores endurance performance, long-term exercise impacts on heart health, and how athletes can train smarter across the decades. Boy, that was an ultra intro is what that was.
It was well done.
I don't know if we've done an intro that long, and I apologize for that. But I think it's necessary to put some context around the discussion that we're going to have, not only on this episode, but on the series of Aging Athlete episodes. Krissy, thanks again for really leading this Aging Athlete series. You've done a phenomenal job of outlining and putting this all together. I'm going to let you ask the first question of Dr. Drum.
Oh my gosh, I'm so excited. This is all coming together. We've been working on this. I looked back at my notes since February. So finally recording. Well, we got our first one out there and we've gotten some great feedback. And I ran into Scott. Scott and I have known each other for 15 or 20 years now. He was one of the athletes on the Montreal team way back in the day. And him and his wife surprised the girls on the Arizona Trail. Jenny, Kathleen, and I got this great message. Hey, we live in Flagstaff now. So I knew Scott when he and Liz lived back in Michigan. So this is really cool that this is all coming together. And so I needed my own little intro. So we've got this long intro. Sorry, Ryan. I have to play with this a little bit. I thought we'd start kind of broad, and then there's some great specific questions that we'll hopefully get into in this hour that we were together. The one we want to make sure that this podcast in this aging athlete concept encompasses is everybody. It's not me closing in on 50. It's the fact that I started at 20 and moved through my 20s and 30s and 40s. And we've got athletes that are doing this. And we want to talk about what we can do now to be better later, and not necessarily better, but just be able to keep doing this thing we love. So Scott, with all of that big intro to follow, what do we need to be aware of when we first find ourselves in endurance sport, whether that's as a teenager, in our 20s and our 30s? When I got into the sport, there was people that were only starting in their 40s. Hopefully that's not too broad and you can get us kind of narrowed down now.
Yeah, well, I thank you. Yeah, great intro on all accounts, and very privileged to be here. The one thing is listen to your body is the big thing when people start, whether they're in their teens or they're even in their single digits, running and doing something. So it's listening to your body, having fun, and then throughout the whole gamut, it's starting out with consistency in setting some goals and duration, not necessarily intensity, not necessarily making something less fun by adding competition too soon. Is that a natural instinct of people or of anyone trying to become a trail runner, competitor? That might not even be something that resonates initially. So it's kind of listening, I think, to the internal dialogue early on, and then deciding: are you naturally competitive? Are you naturally going to add intensity? Are you naturally going to seek out potentially a coach or emulate a buddy, a group that you're running with? So initially, it's really about: can I set myself up for this internal, intrinsic motivation that resonates and keeps me going across the lifespan?
Boy, Dr. Drum, I wanted to make sure I put my hand up first because Scott knows exactly where I'm going. Scott, why don't you tell him exactly where I'm going?
I'm not even going to spoil it, Don.
Because the kernel of truth, everything about our sport is learning to listen to your body. When do you need to train? When do you need to rest? When do you need to keep yourself warm? When is it time to go see somebody for this condition? Is this serious, or is this just me making something up? This is all listening to your body. And I think it then translates to the rest of our lives, listening to the small little dialogue that goes internally that, yeah, maybe I should get this checked out. Hey, maybe this isn't anything I've ever experienced in all my years. Maybe I need to take it seriously. This isn't an inconvenient thing. Learning to listen to your body on the trail and then translating that to real world is a real gift.
I agree. And I love hearing that I've got a 6-year-old and a 9-year-old in my life that I'm like introducing running to, and like only about fun. We walk more than we run, but it's all about, they want to go run with Krissy, even though we walk way more. And I think these are great, like reinforcement of that instinct to just let them have whatever kind of experience they want to have, especially at these ages. But then I kind of want to do get into the science, because I can talk a theory all day. I love listening to my body, and how do we communicate that with our doctors and advocate for ourselves full on. You put us up with some great prompts, and the first one I thought was cool. I remember getting my VO2 max tested in my 20s, and then the doctors telling me hey, you have a pretty solid VO2 max for 20-something-year-old. But what did that mean? Is it genetics? Is it something I'd been doing? I have some answers, but I'd love to hear you talk to how VO2 max then ties into this aging athlete piece.
Scott, you have the answer? You have the answer?
No,
okay.
No, I don't. But Krissy, great question, and I think this could take an hour. Before we get there, Scott, I want you to explain to the listeners that don't even know what the term VO2 max is. Okay. What is VO2 max, and why is it important? And why is a lab technician telling Krissy in her 20s that she has an outstanding VO2 max? What does that mean?
Yeah, and this is just, we could spend days actually on this if you really want to. But the VO2 max, what the comment that I love is teaching students about getting and staying active to promote high cardiorespiratory fitness. So think heart, lungs, vessels. So VO2 max is the maximal amount of oxygen you can take up at max exercise. So most exercise is sub-maximal. And the really way to really look at it is it's pump times extraction. So it's your heart pumping blood. That's a trainable muscle, the heart. And so you can increase VO2 max at any age, at any time you start. You can stop for a decade and start back, and you can still bolster your VO2 max. Heart might shrink as an athlete's heart grows. It'll shrink if you lose that stimulus. But the extraction piece is really important because you're building cardiac reserve by maintaining high cardiorespiratory fitness across a lifespan. So if you start out with a really high one, there's probably 10 to 30% of that that's genetic, actually. And the rest is really trainable. And you don't have to lose VO2 max across the lifespan if you're maintaining something like 7 to 12 hours. So more than what the minimum recommendation is, but 7 to 12 hours of training a week across 20, 30, 40 years really preserves that VO2 max upwards of age 50, which is kind of a crux where now you will be more standardized and lose about 1% of VO2 max per year. But the closing argument for the VO2 max really is that it's an independent indicator of longevity. The higher your VO2 max, the higher you maintain that, independent of any disease or anything you run into in life. And I call it life, for health interruptions do occur. But if you have bigger cardiac reserve, that's what the VO2 max affords you. It maintains that really strong pump, the heart, and the ability to deliver oxygen and extract it at max. But again, we're living submaximally most of the time. And so the bigger that reserve, the better off we are.
So this sounds like a pretty important biomarker. I don't know if that's the right term, biomarker. And I know that there's a lot of really cool wearables out there that say they measure VO2 max. Do they really, or do we need to go to an expensive lab and have this done?
Yeah, and I know you all probably have your own opinions too on this. I actually reviewed an article for Garmin and VO2 max not too long ago, and it turns out the fitter we are, Garmin underestimates the max. And I'm just picking on Garmin. I love Garmin, but there's plenty of others out there, wearables. And if you're less fit, it tends to sort of overestimate. Yet it's a pretty good indicator, off by plus or minus, think 3 to 5 mLs kg a minute. So the milliliters per kilogram of mass per minute is that measure of I have an 80 mLs per kilogram of mass per minute of oxygen I can take up, and 80 is really high. And so if you're Garmin, for women, if you're want to be fit in general, aim for a 40 and above. For men, it's a 45 ml kg a minute and above. But the wearables do good. You do not need necessarily a expensive test unless you are geeking out and really want to do that.
So if I wanted to maintain or grow my VO2 max, and you said you need to train at least 7 to 10 hours a week, how do I train during those 7 to 10 hours? Can it be a casual walk, or do I need to be at anaerobic threshold?
Total variety, and a lot of the time, if people, I always defer back to what is the person, it's the individual. How hard do they want to work? If it's a turn off and it becomes this demotivator to go hard, then the best answer is to just do stuff that feels moderately hard most of the time, at least 5 times a week, if not 6 to 7. And you guys know recovery is important. But the idea is minimum, if somebody doesn't want to hit that 7 to 12 hours a week life, that's a huge dose response. It really is 150 minutes a week minimum. 3 to 5 times a week is fine, doing something aerobic wise, whether that's walking, running, rowing. Getting outside has its own benefits, sense of awe, and lowers blood pressure, heart rate from a stress standpoint. So always try to get outside a few times. Inside is fine. But the idea really is 150 minutes per week minimum as you get into maintenance, and really strive for sort of that 10 hours a week across the lifespan if you want that dose response. And that's probably less than, I don't know if even 5% of the population would want to do that. So it's this carrot that's out there.
Boy, I have so many questions. I've forgotten like 3 of them in the time that you've been speaking. But here's the one that's top of mind. Don started the episode with, we need to train by listening to our bodies. And then we all of a sudden went all the way to the other side and said, there's this science called VO2 max that can help us understand our longevity and our fitness level. Is it possible to feel your VO2 max improve? And I think I know the answer, but I wanted to hear it from somebody smarter than me.
They better be talking to Krissy. But I know Krissy knows this too, and all I think you can, because it's that perception of effort. It's subjective RPE rating of perceived exertion. There's different scales, but I like the 6 sitting in a chair, 20 max all out, can't go another step. And you might have a common route you run, and sometimes you just get into the flow state. But if you feel like you're a 10 or 11, on that perception of effort, that's somewhat hard, or 13 is getting to somewhat hard, 15 is hard overall, heart, lungs, vessels, muscles, feeling of exertion. That same course after a couple of weeks, might feel like instead of a 15, it's down to a 12 or something like that. And then so that self-perception, self-regulation really is important. And then you can probably guess your VO2 is going up.
Yeah, knowing that little bit over time, that rate of perceived effort, that's something I would say I've noticed where if I like heart rate stuff, I knew what my heart rate zones were and everything. And then I kind of left that away for a while. And I've just recently checked back into it, and they've changed, like probably 15 years later. So is there, changed in the fact of I need to keep my heart rate. I can't get my heart rate as high as I once did. And holding it there also is challenging, but I'm still doing it. And my heart rate doesn't get as high as it used to do during a 3-minute interval, but I'm still going to go out there and run that 3-minute. My perceived effort is as hard, but the heart rate doesn't match. Can you maybe touch that a little bit?
Yeah, that's just a sign of us, maybe the volume of training has changed. And I know you and I talked, Krissy, about just, you don't necessarily think you want to be or feel, naturally competitive at this point, and that it probably will come back around. But the idea is that relativeness is, and I run into that right now too. I just go into my paces at 1 to 2 minutes per mile slower than usual, but I'm running a lot less mileage, doing more cross training, lifting weights, doing stuff where I think I have more muscle mass than when I was a pure runner now. So you want to maintain that muscle mass, of course, as we go across each decade. So try to add some strength training, but it's all the same overload. It's just that we are, over time, our VO2 max is being squashed a little bit, just naturally. We're not going to be able to regain that once we turn, especially in our 70s too. You'll have a lower VO2 max. You can't hit 80 again. Maybe you're in the 40s, but the idea is that relative perception of effort is fine to stay. It's going to be hard, but then the pace is different, slower, but it's all the same overload and so forth. And then we just get tired. So the older we get, we're juggling different things, lifestyle wise, I know too, and health interruptions, like I like to say, can and will occur. So students are always like, in general, why train though, and why maybe, reach that higher perception is but just health interruptions is kind of my answer always. I want to just stay high fit, high CRF, cardiorespiratory fitness.
And just to give a little context to that, like maybe it'll come back. I've hinted on this on other things, is the whole perimenopause shift and the adaptation and shift my body's going through right now makes this concept of competition. It just doesn't feel as pertinent right now as I go through this other stuff, but I have glimmers of what might be coming. So anyways, that's that change or that possible that Scott and I got into talking about when I was down there.
Krissy just set us up for a podcast episode. What's to come with Krissy? I love it.
We'll see. Hey, we got some years on that still.
Hey, I will tell you, you briefly mentioned this, and then and I wrote it down under my golden nuggets column. I like to collect gold during podcasts, and this is one of those gold nuggets. You said, as we age, our VO2 max, and correct me if I'm wrong, as we age, our VO2 max does lower, but the golden nugget I heard was, regardless of what age you are at, you can always try to improve, or you can improve your VO2 max. So, I'm a much, much younger man than Don, and it's good to know that even at my young age, I can improve my VO2 max, and even somebody as elderly as Don, he can actually improve his VO2 max. Am I hearing things correctly?
Absolutely. And that's the thing.
Thanks, doctor.
Yeah. Is Don hearing that correctly?
Yeah. Well, Don hears us all the time. Yeah.
Hey, Don. Yeah. Hey, Don, you have your hearing aids in.
Yeah.
Don.
Oh, man, this is rough. Not only did I get hit by the bus, backed over, but driven over again 3 times, Scott, and we're only 19 minutes in.
Wow, time's not flying fast enough, huh?
So, I mean, all kidding aside, Don's, he is not much older, but he's still much older than me. How does someone, regardless of age, and of course, I do this podcast selfishly, so everything relates to me. I'm very selfish. A guy at my age, how do I improve my VO2 max? That's the question.
Yeah, and so what I think of immediately, we've talked about, duration, lower perception of effort, or following your folly, if it's more moderate, but intensity. So now you flip the switch a little bit. If you're coaching someone, or if I'm coaching someone, if Krissy's coaching someone, and they're malleable, they're open, they're not averse to doing something, because I always want people I'm working with or talking to, or my students, to know that it's sort of this give and take. If they're coaching someone, working with somebody, and suggesting high intensity interval training, you can get more bang for your buck. And of course, running, trail running especially, proprioception and so forth, and intensity is automatic a lot of the time, depending upon the terrain and the course. And so go flat, go hilly, but go hilly and push, and maintain some vigorous exercise is greater than that 60% of max in general. That's the definition of vigorous. And most of the time, a trail runner is going to be over that 60%, even on flat terrain, because you're dancing around rocks and so forth. But the idea is to hold back on some days, but some days, and you might naturally feel more inclined to want to go harder because you feel like you've recovered properly before, push. And so once a week, do something higher intense. It can be 2 minutes on, 2 minutes off after a warm up, and doing 2 minutes on, 2 minutes off for 10 times. 5 times. Start with twice, 2 times, something hard with equal rest, and then play around with rest, decreasing and maintaining that intensity. But absolutely, intensity is a key indicator of let's overload that heart extraction piece.
I can't help but bring in the coaching piece of where that can start between walking and running, and then running and like jogging and running and like pushing the pace. The one piece that I would want to like throw in is like really working on form efficiency. So when we run with like our arms going straight forward, our lats engaged, our core engaged, higher like stride rate kicking up behind us, like focusing on a lot of that form piece can make you run faster without improving or increasing the effort as much. So you can find efficiency during these speed bouts, so that you're also improving your form. So multiple things are happening when you're doing these intensity bouts. And if the fitness isn't there quite yet, focusing on form will be a great step to get you to that, like being able to really push the pace. And ideally we do it with the best form possible. I often say if we push hard, our form will go to crap. But if we focus on our form, our pace will get faster.
Love it.
So far in this podcast, my 2 favorite topics, sleep is excluded because that's one of my favorite, but it's listening to your body and form. Those are my 2 favorite things that come up, and it already has on this conversation. And Krissy, you kind of ruined my next question.
Oh, sorry about that.
No, it's good. Because the question has a big hole in it. But I'm just curious about your thoughts. Maybe you've read something or have an opinion on VO2 max at the start line. If everybody, instead of a bib number, had a VO2 max number on, how would people come in the finish line? Because there's a lot of variables, because Krissy just said there's form, there's psychological pieces that you're tumbling around in your head, whether you slept well that night before. There's a lot of variables. But if people wore their VO2 max on their chest, how would the announcer bring people in? Yes, Dr. Drum. Who would I ask that to Scott? Heck no.
I know Krissy's got a wealth of knowledge about that. Because what I think of it, I think of the athlete profile. So what you're hitting on is you would not be able to predict just about anything, with those numbers. You could say, somebody with an 80 or a 90, they're going to do well, but you still can't say they're going to win. Maybe they podium, but it's the athlete profile is VO2 max for endurance running, running economy, and lactate threshold, or the percent of your max that you can maintain for maybe like a 10K hard race, is kind of the proverbial about your lactate threshold is a hard 10K effort for individuals thinking about what is lactate threshold. But it's the amount of lactate you're producing versus clearing. And usually a 5K, a mile especially, or an 8K even, are above lactate threshold. So it's diminishing returns. You're pushing, doling out, whatever energy you can, and that perception of effort, central governor theory, your brain's telling you whether to press the gas pedal or back off. Lactate's probably flooding the system. But the idea really is that intensity for competitive trail runners, even up to 100 miles and so forth. Are you doing 400s, mile repeats? Are you pushing it long uphills and so forth, and then running fast down to pound the quads and so forth? So the specificity of the route and the race matter, and you can simulate that in practice, just kind of work backwards from your goal. But it really comes down to the economy of effort and your lactate threshold. And some people just have more natural ability to dispose of lactate. And you can upregulate proteins. Training high intensity, by the way, at a cellular level, upregulates proteins to take that lactate and shift it from one muscle to another, so it never even hits the blood, like the lactate shuttle. So you got, and then form though comes back to economy and so forth. So.
Well, you've introduced a new term for me, the athlete profile, thinking of the whole piece. VO2 max is just a sliver of the big picture. Yeah. And so I love that term.
I like that a lot. Are you guys ready to take this a little more specific? Because I have like a self-motivated or interest here. And it's
the only reason we do this podcast is for us, Krissy. So go ahead.
Well, a dear friend of mine had a aortic aneurysm and had it replaced a year ago, and she has taught me so much about the heart and the aging athlete heart. And then me chatting with Scott recently, he has episodes of going in and out of AFib, and so we're talking about VO2 max and how these benefits of working out and exercise and 7 to 10 hours a week. Everything has a light switch, right? There's the on and the off, the good and the bad. And so some of this, the thickening of the muscle, the heart gets bigger because it's being tested, and that's a good thing. And is it necessarily a bad thing? But what are these other things we need to really be aware of, having had a long base of endurance activity in our lives? Like, go back, I'll be selfish myself, 20s, 30s, 40s. What have I done to this heart? Sure, I started with a 60 plus VO2 max, but what else has happened in there? And like, bring in your personal experience if you're willing, Dr. Drum, like that would be awesome.
Yeah, and this what sums it up is there's the extreme exercise hypothesis, and it's this reverse J curve that, if you're sedentary, you have sort of a moderate, to a higher risk, in over lifetime, higher risk of disease and so forth. And as you get into this moderate amount of training to actually high training, around that 7 to 12 hours or so, you have decreased risk of disease in general. And yet your heart probably will remain healthy. And then the threshold's a little bit unknown, but it's probably something of that you're doing this for 20, 30 years, lifelong. And this is where I fall in. I mean, I probably have averaged an hour a day since age 10, and I try to go 7 days a week. Wow. So I'm 54 now. So I have well over 44 years of training. And this happened, I'm 54 now. Yeah, 54. But the AFib started at 45 for me. Just about that was, I woke up with it. And it's probably that I'm looking at there's this 5-fold sometimes increase just in lifelong endurance risk of having AFib and bradyarrhythmias, or low heart rate, which can be okay, or supraventricular tachycardia, when you have a lifetime of higher. And also I've seen it doesn't have to necessarily be volume. It's that really maintaining lots of intensity all the time, and not probably taking a 2-week or a month recovery per year, like I've never done, or I try to do naturally. But the idea with the extreme exercise hypothesis is the basis is heart remodeling, which is a substrate for potential AFib. yet I'll finish with right now, as part of that, the risk is still low that anything adverse will happen. And long-term athletes and just in general, exercising and high fitness, longevity is greater in those people who do that versus inactive.
So we have a lot of endurance athletes out there listening, I presume, and they're probably asking themselves, just like I am, so what did that feel like, Dr. Drum? You woke up at 45 AFib. How do I know? Maybe I've had it.
Right.
What do I look for?
That's great.
Yeah. Well, one thing is, if you look just underneath your Adam's apple or suprasternal notch, you might feel like this weird twinge or palpitation because it's AFib is in the atria, which are supraventricular, above the ventricle. And so, since I have a cardiac rehab background, I was like, oh crap. I think I know what this is.
I know what's going on.
And I was at Northern Michigan University at the time, and I went into the lab and just took myself up to an EKG and was like, yep, AFib, and brought that into the ER so they could document it. Of course, tip, if you really want to get seen in the ER and it's crowded, say you have a heart problem.
Ooh.
Oh, wow.
But then, because the gist of it is, it's paroxysmal AFib, atrial fibrillation is what I was diagnosed with. I went to Mayo Clinic, and that's one strategy is like, I was like, okay, I'm not messing around. I'm going to go get a big time VO2 max test, and they tailored it to my fitness. So it was like 15, 20 minutes. I actually knew some people at Mayo Clinic in Rochester, some ex-phys people. And then, an expert looked at the EKG, non-invasive way to look at coronary artery disease, and they ruled that out. And so lone or alone atrial fibrillation, and the paroxysmal is sudden onset and no cardioversion. No, I sometimes take an antiarrhythmic, but over 80% of the time, I just come out of the arrhythmia on my own within 4 or 5 hours up to 24 hours is my record of being in it. But the bad news is that usually it'll progress to more persistent AFib, which can last for weeks, to permanent, AFib, and there might be a slight familial, risk as well. My father, 86, permanent AFib since 68. So
Wow.
I look to him, and yeah. So I've been having these bouts, like 35 plus bouts since age 45 to 54. And it's a parasympathetic vagovasal where the heart rate comes down potential effect, because I rarely am I awake. And so I just wake up and my heart rate stays below 60, 70. I've even run with the AFib. Not recommended to go up hills because you do lose cardiac efficiency when you're in AFib to get blood pumped. But that risk is still like less than 1%, or it's a percent risk. And as we age, when you hit 75, the risk does become 10% of the population will probably have AFib by 75. So, but even now, all of you have less than 1% chance risk. I feel like I won the lottery.
Yeah. Should bought a ticket.
Or is it? Yeah,
and staying in AFib, that's the counter, like explaining what being an AFib is, like what is the bad part of the experience for the heart or therefore the body by being on that counter wave.
Yeah, well, yeah, and so I think I might have gotten off track a little bit, with because you'll feel like palpitations, and you can even do the atrial or radial pulse on the thumb side. It'll be very erratic pulse, and if it's above, usually if it's a rapid ventricular rate, the AFib is the atria are quivering at 350 to 450 beats per minute. But then there's a structure in the heart which can slow that, and you don't want your ventricles. If your ventricles were at 200, you'd be passed out. Lack of blood flow to the brain. But it feels like a bag of worms quivering in your chest. AFib, and if it's over 100 ventricular rates, then you're going to start to feel awful. And sometimes the rapid ventricular rate will be 120. 160 even at rest, 160 beats per minute at the ventricles, atria quiver, and so that's where you'll feel crappy, and then you really need to get to the ER to get it documented and maybe cardioverted, and maybe someone spontaneously comes out of it. But docs for athletes say pill in a pocket, which is the route I went. No ablation. Ablation is always discussed, But a pill in the pocket, an antiarrhythmic, never works for me, and so I just come out of it, or I'll take one. But what's cool is that it's something that hopefully is diagnosed sooner than later, and with the Apple Watches and the Garmin and other things now, there's FDA approved ECGs, apps and so forth. So more and more people are probably going to be diagnosed.
So help me out here. So I have an option of pill in the pocket. I mean, consulting with your doctor, of course, there's a pill in the pocket. Ablation, and help me and correct me if I'm wrong, I probably am, is like a jump start, or you go in and the doctor somehow kind of shocks the area and brings you back to a normal rate, or kind of interrupts the cycle. Is that the ablation?
So you were just describing what would be instead of defibrillation, it would be a cardioversion, which would cause the heart to stand still for a second, but in a safe manner, to reset the pacemaker of the heart, your SA node or sinoatrial node. The ablation is something that quarantines off the pesky little active area of the atria that might throw off a beat that interferes with your normal pacemaker. And the ablation is, I think you can go in nowadays through the wrist. There's less invasive ways through the chest, or through the femoral artery, through the leg, and it's there's ultrasonography or high radio frequency, cryotherapy, and you're putting like a little gate around this pesky tissue, because as we age, the heart can become more fibrotic, and these little pieces of tissue, not viable contractile tissue, can set off a premature atrial contraction or take over pacemaking, and then it becomes chaotic. But it's always about the rate. It's rate and rhythm is what they look at. So does the pill help you get back to normal rhythm? But if it's a high rate, you're going to feel crappy. So, they're trying to treat those. And so cardioversion usually is a big tool, especially if people have known coronary artery disease or calcification of the coronary arteries. AFib can usually be secondary to that, and especially open heart surgery. There's a really high risk after there's the bypass surgery in the CVICU where my wife works. Liz works there, and she will usually have people going into AFib in and out of it. So, but the alone paroxysmal AFib that I've been diagnosed with, and that most athletes might be, is not secondary to anything else. So you're until you are.
And so does this make someone a candidate potentially in the future for a pacemaker? Does it set them up for, we've tried everything, and it looks like pacemaker is how you're going to have to move through the trail from now on?
Yes, that's a possibility. And one thing really quick, by the way, is that your doc, like I was asked this, the cardiology, the EP doc, Dr. Peter Noseworthy, at Mayo Clinic in Rochester, I said, should I get ablation? This was, 9 years ago. And he goes, you will tell me when you want that, because it interferes with your lifestyle. And so far it hasn't necessarily interfered. Yeah. I don't want any catheters going towards my heart. Yes.
Okay.
Yeah.
So I'm going to shift this. We've been going down this one trail, and I see this really fun side trail that we're going to go down. And actually, Don saw that side trail and he thought, this is one of my favorite subjects, which he mentioned earlier in the podcast. So we're going to talk about it. Let's talk about the scientific insight that you outlined, Dr. Drum, on sleep, social connection, and recovery. Let's talk about how much sleep should we be getting, and does that change as we age? Let's start there.
Yeah, and again, I know that you all have experiences, in Krissy especially, and then with her second edition of the book and so forth. So, sleep 7 to 9 hours, and it depends upon the individual, but 7 seems to be, from what I've been reading, kind of the crux. So just for me and others I talk to, it's about 7, but others are at 8 or 9. My wife Liz likes 10.
Yeah.
But it tends to go down too. Sleep, the amount of sleep we need tends to go down as we age. We might become earlier risers and so forth and whatnot. But sleep is probably the number one thing a lifelong endurance trail runner can do to help promote more lifelong training.
I love that. And we've always said, if you're in the gym, if you're on the trail and you're stressing your body, the growth doesn't come from the stress and the tear down. It comes from the rest and the recovery. So I think that's great that there's science behind that. The thing that I was most impressed with in your notes, Dr. Drum, is let's talk about the scientific proof of the social connection of longevity. Talk to us a little bit about that.
Yeah, and that's on the peripheral of, like, from a cellular standpoint. I think it's, that's anybody's guess, but it's more of that plasticity of the brain and how our internal dialogue is with our community, or the people that we associate with, and having the ability to be heard, and to talk with different individuals. But from what I see the sleep and the high cardiorespiratory fitness and the social connectedness as those big three a lot of the time, as we age and go across the lifespan. And so because the connectivity, the social connectedness, especially in trail running, creates adherence across that lifespan, we have more joy, and it's internal and external, kind of thing as well. And so I think that from a cellular standpoint, we're preserving our. I think it does. I didn't see this, but I'm going to guess. Krissy and I were talking about this. The telomere length. You're preserving your DNA. And your immune system reacts. A lot to self-perception. And having social connections really broadens that and decreases stress about being alone, because being alone does decrease lifespan. And so we want to seek out and cultivate, and we have that choice to do that.
And we talk a lot about the magic and the wonder of, the trail community, and it happens other places too, rock climbing and surfing, in places where there's chaos and danger, I think, is where people come together and they bond, because we require one another for safety. It's dangerous out there. It's like, it could be running at night. There could be cougars. You could get lost. There's all kinds of catastrophe that can happen. And I think that community binds together because of this. And I think that's why we enjoy it so much. When there's risk, there's connection.
I love that piece about how your body responds to your own internal dialogue. My brain is just like spinning on that right now, and or the joy you feel like after running with a group of friends, and like, yeah, you're alone, but you're still like in that afterglow, and what that does. Like, how does your body then chemically change? Like, those cells are like lighting up, and I just think that could be a cool visual. That's where my brain's going right now.
I'm curious, because trail running and ultra running, there's a little bit of a dichotomy, because you spend a lot of time solo on the trail. If you're training for, an adventure or a race or something, you spend a lot of time solo. But then we have this community that kind of is like-minded, and they have the same understanding of what makes the sport exciting. So is there research that says how much time we need to be spending with our running group? Is it once a week on the Wednesday night running group, or is it once a month when we go to our race? Is there any? Give me some ideas for those introverts on this podcast that are listening, that are saying, I enjoy running because I want to be out there. Convince me that the community and this interacting part is better for my longevity, so that I can age gracefully and more successfully.
Scott, you're bringing up the athlete profile. I'm using my new term. Go ahead, Dr. Drum.
No, I don't have a specific answer, because I think, again, it goes back to some individuals are very, and I'm more of an introvert, believe it or not, and I just want to go relax after doing a lecture or something like that, and all that. But I think it's up to the individual. And I always say, I think I'm overusing the term organic or natural, but it really does. And it comes down to that, like, how do you feel about doing that? And I read all this stuff on social connectedness and a sense of awe too. Outdoors trail running, there's nothing like it, where that decreases infection or inflammatory responses, and stokes your immune system because you're less stressed, lowers blood pressure. If you're just getting a sense of awe. And so the thing is, I think it's up to the individual about how much time they feel. Yet if they've never had any social connectedness or connected with a running group or a running buddy, seek that out and see what it's like. And maybe that's not something for those people that are very introverted and really are choosing. I think the important point here is show up how you want to be.
Right.
Yeah.
So
Yeah.
I mean,
Good point.
social media. Is it bringing us together, tearing us apart? Well, I mean, the word social's in there. I had to bring it up.
Open that can
That's a
of worms,
can of
Freeman.
worms for sure.
Yeah. One phrase. Turn your phone off.
Yeah.
Okay.
That's not a social
That's not a
connection. Even
connection.
though it's called social media, it's not a social connection.
Well, you know what comes to mind is periodization. You know, we talk about that macro cycle.
Oh yeah.
Periodize your social media. You know, here I'm going to do it for this month, but for a couple of weeks I'm going to turn it off. You know, and I'm going to bring it back for this month. You know, you can definitely periodize nutrition, periodize training, but periodize sometimes, you know, the amount of a social outlet. You know, too, or I mean, the social media stuff can be a brain drain.
I think I'm suffering from overtraining.
Cool.
You know, one of the next sections I thought that we discussed or that you brought up, Dr. Drum, was the cellular aging. Talk about that. How do our cells change over time? We're constantly, you know, cells are dying, new ones are being produced. How does the cellular stuff change, and what information or knowledge of that can help us become better aging athletes?
Yeah, and I know that it's kind of a losing battle as we age. You know, from 20s to 50s, 60s per decade, we're losing muscle mass. We're losing heart mass. Our vessels are becoming stiffer. You know, our skin, of course, is the fast dividing cells and replaces itself. Red blood cells replace themselves every 120 days or so. So we have stuff in the blood compartment, the skin compartment. Nervous system doesn't easily replenish, and so you want to keep skeletal muscle activated with innervations and so forth. So the big picture is from the head down, really thinking about preserving cells that you have, and pertinent to the trail runner really is skeletal muscle mass, which increases mitochondrial density if you have more mass within the muscle, and the mitochondria is a powerhouse that fuels muscle action, contraction. And so adding strength training also refutes cellular depletion in general. And always during training, whether it's trail run training, getting in the gym 2 to 3 times a week, full body exercise will help preserve cellular structure and all of that energy, metabolism that comes with promoting lifelong movement. And so just in general, I will say that the body self-programs cell death across the lifespan. And so you can prevent that rate of cell death and DNA denaturing, or promoting positive change in DNA, or if there's adverse cellular situations where cells are dividing out of control, your body's better able to attack that. You're keeping genes and different things regulated to fight infection.
So, doctor, if red blood cells are being reproduced, they die and they're not reborn, but they're replaced. Why is it that my 20-year-old body was making new red blood cells, and now my 60-year-old body's doing it too? But do I have a bunch of 60-year-old red blood cells running around, or essentially is a red blood cell in a 20-year-old and a 60-year-old identical if you put them under a petri dish and you said, hey, which one's 60 and which one's 20?
That's a good question. Well, it could, because you're regenerating, yet the tissue, the components, iron is a big one. Ferritin is part of that. Hemoglobin mass is part of the red blood cell. And I believe those things can change. The red blood cell, the health of the cell can change, but I'm not 100% sure Don, that's a really good question about, what you would see under a petri dish. So I've just, that's a great question. I've never heard of that, and I don't want to step on my own toes.
There's no risk of anybody
But-
calling you out on it. Very few people, so don't worry.
But the idea is that you're I mean, what it was cool though is that your O2 saturation rate, you have little finger pulse oximeters, and usually you're at 98, 99% saturated at sea level. In Flagstaff here, you might be at 96, 97%. But the idea is that 20-year-old, 60-year-old, you're going to be, if you're all things being equal, you're going to be at your 98, 99% saturation, unless there's a pulmonary problem where you're not getting oxygen into the blood. Emphysema is one of those things where, now you're killing off air sacs and they don't regenerate. And now you're going to have, below 90% saturation, or usually 88% is a clinical situation. So
another quick little side trail, and we're just going to go down it just for a minute, and then we'll get back on the main trail. You mentioned iron and ferritin. Should we, as we start aging, and I don't know at what point in the lifespan, should we consider taking some iron supplements so that our ferritin levels are better? Does our ferritin level drop as we age, and as we go out and work out?
Well, there is a normal range, and I know Krissy can speak to this as well, and especially in female runners, trail runners, ultra runners, and so forth, with the menstrual cycle, you want to make sure iron is at its normal level, and that can change between men and women and age-wise, but definitely consult with a physician and have it physician directed as to whether or not to take iron supplements. One quick caveat, though, is that a lot of runners coming to Flagstaff right now need and should have their iron checked. If they're not at an appropriate ferritin level or overall iron level, they will not respond to altitude training, because that's the piece that goes into the iron, is what helps you carry oxygen, and you're making more red blood cells. And maybe you have total red blood cell mass, but you don't really have good hemoglobin, which is where the iron is to bind oxygen. So if you come in low, in your 20s or 30s, you're not going to respond, and you're going to feel awful. And so, but as we age, it's good to have to meet with a primary care provider, especially past 50, on a yearly basis, and have that blood work done and check the iron.
That's a very good point. And at one point, Don and I had our biomarkers checked by a company. How important is that? Is that something that we should consider as we are younger athletes, and as we get to each decade, maybe once every 10 years or every 5 years, that we go in and whether it's to your primary care physician or doing one of these online biomarker tests?
Yeah, and I think that's a personal journey of each person. From what I've read and seen, I go back to, there is no magic bullet except lifelong activity and nutrition and sleep, all come into play, and that social connectedness. Yet some of these tests are very good. You can do genetic testing or find out risk factors, or eat towards your blood type. Those things can help. I tend not to do that myself. I tend to just eat a holistic diet and not any one thing, and really focus on the things I can control, as far as sleep goes, and how much exercise I do a day, and just staying connected. So and I know there's mixed bags on that, yet I think that's an individual choice.
I've been dealing with anemia ever since, gosh, I was like 16 or 17. My cycle kicked off. Took me through a whole thing, and I've had to have iron tested my entire life. And there's been times in my 20s I'd forget to buy the supplements, and I would suffer like fatigue and all that. I was most interested recently, some friends of mine are on the opposite end of the spectrum with similar symptoms. So the iron abundance versus iron deficiency actually ends up having similar symptoms in people. So again, the importance in that case of being tested, where I think Camilla Herron is one that's been public about it, that she was taking iron because she was having the fatigue and lack of motivation type symptoms, muscle heaviness, but turned out she was actually too high on the scope of iron. and I can't help but let my brain go down this track of similar things with this perimenopause transition where your estrogen is doing all sorts of wackadoo things. And if we're supplementing with HRT, the symptoms of too much estrogen and not enough or bottoming out estrogen can also be the same. So it's not a promotion for this testing, but it's a reason to like figure out where you are on the spectrum when you're having like fluctuations like that.
Yeah, absolutely. I agree. And the whole maintaining contact with the primary care provider who can then pass you off to a specialist, I think is important to note. And some of us are like, I don't want to go see anybody. And and it's usually, yeah, you probably, should try to do that on an annual basis, especially into the 50s. Yeah. So
Dr. Drum, you've been very helpful, and I think we've only just touched on how much information we can suck out of your brain and your experience.
No, how much we can put in our brain, Scott. I don't think there's a limit to Dr. Drum. I think it's a receiving.
How much we can absorb.
We're the limiting factor. You used to run on the Montrail team. Trail runner. Lifelong athlete. For those people that are listening to this, regardless of the age, what advice would you give them overall to say, if you want to run your entire life, to really, you enjoy this sport and you want to continue to do it, what are the 3 things that you would recommend they do? Is that a fair question?
Well, yeah, it's funny because I always think of like, get active, right? If you're not, and I know a lot of listeners here, on for Trail Runner Network and so forth are active, and stay active. It's that consistency, and then build that social network. I still think that's one of the most important things for adherence across the lifespan. And I guess, that's kind of like stay active, build that network. And then periodize your training, add weight training in there, especially, I've been saying 50s a lot, but even a little earlier, 30s, 50s, anytime you can do it. But as we age into our 40s, 45, 55 are some cruxes, I think. But it's full, and it's compound movements. So you're throwing around iron, in the weight room and doing compound movements like a stiff-legged deadlift, or a back front squat, or a power clean. You can start workouts with that. Full body activation is important for any age. And of course, the sleep stuff that we talked about. But really, it's the whole thing of stay active and keep going, and find that adherence. What's your strategy to maintain it? Because and I think that feeds into the staying active, but it's still something that's so important, the consistency of that. And so that sense of awe as you go outside, and that connectiveness is kind of the 2 I put in there as kind of that 3rd one. Stay active, get a group.
And I think that those 2 kind of build on each other too. If you have a good community, a good network of friends, it's easier to get and stay active. Because there may be times when Dawn isn't really wanting to go run, but I'm on a mission to up my training, or like right now where I need to get active, and Dawn's saying, okay, let's get her done. Let's get out there. We're going to go out there 4 days during the week, and we're going to go out there on a long weekend. I think those 2 things kind of are interdependent on each other, and can really help you. So if you don't have a community if you're listening and you don't have your community, go to your local running store, or go to the local trailheads and just ask somebody if you can tag along. I think it's really, really important. Dr. Drum, go ahead. Go ahead.
I was just thinking of a Ted Lasso quote, stay curious, right? Be curious because of the goals. And I think, and that's why, of course, we all want to say goals. And so that's why I was kind of trying to say it more in phraseology there. But the whole goals is being curious about, what if, and you don't have to be the fastest runner and so forth. It's do something, do an adventure run, plan something is really one way to keep it going. Yeah.
I love that.
Dr. Drum, as I'm listening to this, I'm fascinated with with what you're sharing with us. And if I was, a young person looking for a career, or I was a parent listening and thinking, you know what, I'll bet you my son or daughter would enjoy this type of knowledge or experience or profession. Tell us a little bit about, what you do or what you are or what you can do with being an exercise physiologist. Give us a little bit tell us about the people that you lecture to.
Well, as an exercise physiologist, exercise sports science and slash fitness wellness is the primary major at Northern Arizona University. Yet kids sit and become an exercise physiologist, or they take this certification through the American College of Sports Medicine. One big word though is network. As you become an exercise physiologist, you're part of an interdisciplinary health network of physical therapists, athletic trainers. It can be physician assistants, nurse practitioners, even physicians, sports medicine physicians. And you have the ability to look at different populations of disease like cancer and cardiac, or chronic fatigue, different muscular dystrophies, pregnancy. How does someone interact with exercise if they're a beginner versus active person already going into pregnancy, or looking at the training age of someone and then writing an exercise prescription for life, and it's really about taking those goals and then putting together a plan of exercise, maybe testing to prove your point across the exercise prescription. But all these people you get to work with have some crossover. And RDNs, so registered dietitian nutritionists, is another part of that network. And even public health, in general, working with communities and giving awareness about physical activity and exercise across the lifespan is part of this exercise physiology. And so most of the students will go and potentially work as personal trainers or as fitness directors, and then allied health, fields. Like I mentioned before, a lot of those different disciplines, they have the ability to jump into and become a doctor of physical therapy or a doctor of occupational therapy, or med school if they want to go that route. And they can always tell their patients, here's the prevention. What we've talked about today is really about prevention of musculoskeletal disorders and bad knees, hips, is prolonging the life of our joints and keeping our heart and lungs and vessels healthy, I think, is most important message that our field gives people.
Well, I mean, this education would be not only for a career path, but also for a personal journey of having this kind of knowledge that you can call to as you move through different phases of your life for you or your family.
No, perfect. Because I was just thinking of I think of like academia. Then if kids, students, or if anyone wants to go on and get a terminal degree in exercise science and become a research scientist, they can research aging and trail runners. And I think the job of working at a university is a lifestyle. It really is. And the ex-phys part of it creates even that, when you're teaching ex-phys and so forth, you're really living a lifestyle, and you're autonomous. You're very autonomous in your job when you're teaching.
Tell us a little bit about Northern Arizona University. Is that where is it? And
Arizona.
Why? Yeah, Northern Arizona, yeah. Freeman. Yeah. Jeez, see what I have to deal with? Do you see what I have to deal with? Tell us a little bit about it and why somebody should consider going there. I mean, you're absolutely, obviously there. So why should someone else go?
The Arizona Trail goes close through there.
Yes. Yeah. It's well, for the listeners here, if you really want to naturally build your VO2 max, and you want your kids to have that natural, it's at 7,000 feet, so that naturally upregulates red blood cells. So just while you're sitting and listening to lectures, so you're increasing your VO2 max and maybe your running economy. But I think I think it's a lifestyle. Again, NAU, Northern Arizona University Flagstaff, is such a nice community, and you've got that sense of awe just driving through campus and so forth. And I think that the idea of, from an ex-phys standpoint, fitness, wellness, just general lifestyle, I think that's what this area connotates that. yet there's good science going on. There's good research. There's always something to do as far as outdoor physical activities and different groups to become a part of. So it's that, do you find your environment and go there kind of situation.
Yeah.
Love it.
Well, great. Thank you so much, Krissy. I just hit me. You wrote the book. It's in its second edition, Running Your First Ultra. I think I have a proposal for the next edition title, Running Your First Ultra and the Rest of Your Life. Because I think that this is not a book for just the beginner. I mean, you can go and reread this book over and over and over. What are your final thoughts for this episode of The Aging Athlete? What did you learn, or what takeaways do you have, or what would you like the listeners to remember?
Oh man, I just think we just launched off to all these other chapters we get to look at in these next episodes. Thanks, Dr. Drum. It's funny, I call you Scott, but on here I'm calling you Dr. Drum. I just am really thankful we got to dig into some more specifics when it came to heart stuff, and then pull back the picture and look at the broader scope of how this all applies. I love the reinforcement of how community is such an important part of longevity,
Right.
and to hear that from a scientist is I love that piece. Huge thank you for being our first expert.
Oh, you're welcome, and thank you. It was a privilege to be invited on here, and I thank you for that. Krissy, for making all the connections, and I think some sort of lifestyle book, aging book. If you ever need a co-author,
collaborate.
Yes, I think it's a whole new title. I've got a new perspective now.
Exactly,
and a new book for us to review. So I think it works out.
Yeah,
excellent.
Well, regardless of your age, go find a good pair of shoes, put them on, and go out and run.
Mas.